you've been a huge advocate for folks to get the vaccines. So what are your thoughts now that we're looking at a booster shot about 8 months after the second dose, I should say?
Yeah, so this isn't surprising to me. And from the beginning, people have always said, do you think we're going to need another round of this vaccine? And, given that this is a virus and viruses are very delicate and they can mutate, and we've seen what happens when they mutate right now, living through the Delta surge. So I'm not surprised by this guidance that might be coming soon. We have been kind of planning for it and anticipating what will that look like. What will Columbus Public Health's role be? So we'll be looking forward to getting the final guidance from the FDA, ACIP, and CDC so that we can proceed in protecting our community.
And, we've seen a big push recently with the Vax cash programs, trying to make sure that folks even just get those first vaccines. I mean, do you think that we're going to have to see something like this again in order to entice folks to get that booster? Are you concerned that people might just opt out and say they just don't want any more shots?
I hope not. I hope that's not the case. I hope that once people go through the primary series and they see how their body adapts and adjusts to that, that won't deter them from getting that third or that booster shot when it's needed for them. We've been very successful with our Vax for Cash program. We vaccinated almost 9,500 individuals through that program, and it's been so successful. It's been replicated across the state of Ohio as well as across the nation, and we're going to extend it another 4 weeks. But I'm really hoping that when people see that, yes, I can get vaccinated, yes, I didn't get that sick, yes, I still feel okay, my arm didn't fall off, they will continue to roll their sleeve up again when time comes for a third shot or a booster shot, whatever we choose to call it.
And are there concerns that, like you said, when we see these new strands, like right now we're seeing this Delta variant, is there a concern that if folks aren't getting these booster shots or if folks still aren't getting vaccinated, that we will continue to see new variants of this virus? I mean, is this kind of an incentive to make sure that we just kind of take care of this and we are able to move on from it?
Well, again, this virus is a very smart virus, and it has outsmarted us in so many ways already. And so I think that we need to get people protected. So we need to get their primary vaccine series on board. We need people to follow up and get their third shot or their booster shot. And we need people to do the right thing with their behaviors, mask up when indoors, keep that social distancing when appropriate, stay home when you're sick. And hopefully with this, we will start to see our cases go down over time. But like many professionals and experts around the country have said, this virus will likely be with us for a long time, just like the flu virus. And so there's going to be some normal or level setting of what we can expect for this virus activity. But definitely we hope that it can reduce our hospitalizations and reduce our deaths from this virus. When I talk to our hospitals here in Columbus, they tell me that the majority of the people in their hospitals right now with COVID-19 are unvaccinated. One hospital in particular told me 96% of those who were hospitalized currently with COVID-19 are unvaccinated. And 100% of those with COVID-19 who are either in their ICU or on the vent are unvaccinated. So we really need to get our community vaccinated so we can avoid some of those hospitalizations.
And, I was reading about this recommendation, and it seems like right now it's for the Pfizer and Moderna vaccines. So what do you think this means for folks who may have gotten just that single dose Johnson & Johnson shot?
Well, I think that we still have to wait to see what it looks like for them and what kind of guidance we get for that group. And we know that's a large percentage of our population. So we want to make sure they're protected as well. So I anticipate that there will be guidance in the future about how we handle individuals who got that single dose of Johnson & Johnson.
And is there a concern at all, do you think, about supply when it comes to getting a booster shot versus folks who may not have even gotten a single dose of the vaccine yet?
From everything I've heard from our colleagues at Ohio Department of Health, the supply is not an issue here in Ohio. So we should be well equipped to be able to provide that primary series for those who need it, and that third dose for those who are eligible.
And in terms of time frame, I think the recommendation said about 8 months after that second dose. So, for someone like me, I got my second dose at the end of April. So we're looking about 8 months out once that recommendation comes through. Just to clarify for folks who say, oh, I got my shot at this point more than 8 months ago. Is it too late for me to get a booster? Do we know anything about the specifics for that time frame yet?
So usually what we give people guidance on is the earliest date you can get that booster. And so there's going to be some wiggle room. So if you're at 9 months past your second shot of either Moderna and Pfizer, you would still be eligible to get that third shot. If you're at 10 months, you'd still be eligible, but we don't want to give it before 8 months. And so, the beauty of this, and you asked about supply, is when we started the vaccine rollout here in Ohio, we really started with our healthcare providers and those living in nursing homes. And so that was a very small segment of our population. And then we slowly but surely added up, included more people who were eligible. So initially, when the 8 months mark comes, it's going to be a small segment of our population who will need that vaccine, that third dose. And then as time goes on, there'll be more and more people who will be eligible for that third dose.
And that's what I wanted to ask finally about that eligibility, about that rollout. Are we going to maybe see it kind of the same way we saw initially with the vaccines, that our most vulnerable population takes priority, healthcare workers, frontline workers, the elderly? We are seeing it already with the immunocompromised. Do you think we're going to see some similarities there?
Well, I imagine to some extent we will see similarities, but also we just have to keep in mind it's the 8 month window. And so knowing how we rolled out the vaccine here in Ohio, it was based on, risk of exposure, risk of illness and death. And so it was our healthcare workers, then it was our long-term care facility residents, and then it was our elderly. And so we will see that same cadence move out as we go through and provide that third dose or that booster shot.
All right. And I know we briefly touched on it at the beginning, but I just want to hear your final thoughts on this, in general, just making sure that people are getting those shots, whether it's for the first time or whether it's a third or a booster shot. I mean, how are you feeling about all of that?
Well, again, this is no different than what we've been doing with the flu shot. We get a flu shot one season, it doesn't protect you for the next season. And so this will be slightly different because it's an 8 month window versus usually with the flu, it's a 12-month window. But everything about this pandemic and this virus has been new, so we have to adjust. I think it's the right thing to do. I'm looking forward to being able to offer that third dose to our residents. But right now, I really want to put the priority on getting people vaccinated with that primary series. And that's what we're doing with our Vax for Cash program.